Hi there, welcome back to N-Powerment Nursing. I'm Ashley and I'm a nurse educator, and you are turning into our weekly application of In the Know, where we do our best to make it simple. Today we are applying our Facebook Live run earlier this week called Respiratory System Hacks. If you didn't catch it live, please pause this, log out, go check out that video and watch it first because it's really going to help you come to the right answer for our question. So, our question is, a patient's history of pulmonary disease has resulted in the functional loss of alveolar cells. When assessing the patient, the healthcare provider would expect which of the following select all that apply. Wah, wah, wah. We all get afraid of select all that apply questions, but the best way to attack those is to treat them as a true or false. So I invite you to put your guess into the comments below and then play the rationale. So here's our options. A, hypoxemia. If a patient has lost the alveolar cells, you might remember those from the textbook looking like little grape-like clusters, right? Those are the little sacs in the base of the lungs that open and close to allow for oxygenation, also known as the gas exchange. If you lose those cells, would you have hypoxemia or low circulatory levels of oxygen? Absolutely, that is true. So we are going to circle A, hypoxemia, as an expected finding of the patient with loss of alveolar cells. B, jugular vein distension, or JVD. This is a cardiac issue, right? When the right side of the heart backs up to the rest of the body and you get jugular venous distension on your right-hand side, that is related to heart failure, has nothing to do with loss of alveolar function. So B is not applicable. We will not circle that. C, hemoptysis, which is the nursey word for coughing up blood. Hemoptysis is not necessarily associated to the loss of alveolar function. It's more like pulmonary embolism. TB is often associated with that, so we are not going to circle C as being applicable. D, production of copious mucus. Losing alveolar cells does not promote mucus. Things that promote mucus are more like COPD, emphysema, bronchitis, pneumonia. So we are not going to circle D. And lastly, E, dyspnea, the nursey word for difficulty breathing. Well, if you have a loss of the gas exchange in the base of your lungs because your cells have died, you will be getting less oxygen. Would you have difficulty breathing? Yes, you would. So E is also a correct answer. So the answers that we are going to select as applicable then would be A, hypoxemia, and E, dyspnea. So thank you so much for joining me today for the answer to this question and more. And for all concepts simplified for your registration exam, please check out our complete study package on our website. I'll see you next time.